My name is Dr. Nick Wills. I'm an orthopedic spine surgeon at Summit Orthopedics in St. Paul, Minnesota. I first heard about Mobi-C from a person who had been a rep from a different company who now works for LDR, and he wanted to meet with me and said, we have this newer technology, which is I think you're gonna like. He talked to me about it, and immediately I said, okay, when's training? Just get me signed up for this immediately, because this is something that no one else has and no one else can do. And our job as surgeons is to always find the safest, most appropriate thing that can make people better. There's a number of cervical disc replacements, and there's a number of fairly good ones. But the big feature was the ability to do this at 2 levels. All of a sudden you could do a disc replacement at 2 levels. And frankly, that's when you want to do it. A 1-level disc replacement is great, and there's advantages to it. But the real advantage, and we're seeing this in the literature that has been put out now, the 4-year data, is that the 2-level is a remarkably different situation. It's a remarkably better situation. The 2-year data is superiority, which is in the FDA world is a big deal. One of my most famous patients works for a hardware company, and his family was living check to check, because many Americans do. And he said, Doc, I can't take days off. I just can't. And he had needed a 2-level surgery and a 2-level fusion. No matter how good of a surgeon you are, they hurt for a little while. At least they don't feel very good. And it ended up that we were able to get approved a 2-level disc replacement, and he was back to work on post-op day 4. He was exceedingly happy. And for us to be able to say, no, you can go back to work. You need to be careful, you need to be smart, but you can do that, and you're gonna feel good enough to do that, was pretty neat. It was a good experience. It's remarkably changed my practice. I did this training, and it's no different. In fact, it's probably a little bit easier than a cervical fusion, which is usually a fairly routine surgery. We've had people come to see us that wouldn't have come to see us otherwise, just because of the technology. I think that that's been the biggest benefit, is giving people a different option than a 2-level fusion. And I think they've been, so far so good. It's been going very nicely. So when I talk to patients, I tell them that if you keep things moving, that's better. If you don't keep things moving, that's not as good. And if we have technology to keep things moving and to allow motion in multiple planes, not just in one plane back and forth, which some of the other discs do, but in multiple planes where that you can keep a relatively normal physiologic motion, there's advantages. And the more that we show people the technology and offer them, maybe more appropriately, offer them the technology, hopefully we're going to be giving them a longer-term solution for a problem. Our goal as surgeons, our goal as companies that supply things to surgeons, is to make patients happy.